આજે નવો એક આઈપીઓ ઓપન થતો તમને જોવા મળ્યો છે રેઇનબો ચિલ્ડ્રન્સ મેડિકેર ઇન્ટરેસ્ટિંગ કંપની છે અને બાળકોની સ્પેશિયાલિટી હોસ્પિટલ્સની અલગ અલગ શહેરોમાં ઘણી બધી બ્રાન્ચ છે મેઇનલી સાઉથ ભારતમાં તેમનું વધારે યોગદાન છે. વધુ વાતચીત કરીએ રેઇનબો ચિલ્ડ્રન્સ મેડિકેરના ચેરમેન અને મેનેજિંગ ડિરેક્ટર રમેશ કાંચરલા અત્યારે આપણી સાથે જોડાઈ રહ્યા છે. રમેશજી, ગુડ આફ્ટરનૂન ઓલમોસ્ટ એન્ડ વેલકમ ટુ ધ શો. ફર્સ્ટ ઓફ ઓલ, લેટ અસ નો અબાઉટ ધી કંપની એન્ડ વોટ થોટ process let you to this process to going public, sir?
Yeah, good afternoon. Very good afternoon. So the Rainbow Children's Hospital is a children's multi-specialty hospital in 6 cities in southern India: Hyderabad, Bangalore, Chennai, Vijayawada, Visakhapatnam, and New Delhi. So what led to kind of going for a IPO? Our size of our company is fairly decent, and we have been doing very well. We have an investor on the board for the last 9 years' time, which is CDC, the UK government-owned private equity fund. So we have a mandate to give an exit, and also we have a ambitious plans to expand our 40 expansions in the south as well as NCR area. So these are the reasons we are looking forward for the public listing.
Okay, sir, good afternoon, and of course you are doing a wonderful job. I have read about you, and we are in Bombay also. We have a specially for the children SRS hospital. So of course in abroad this concept is very popular, but how do you see, you are a multi-speciality hospital, what kind of specialty services would you be providing?
So we are the larger format of children's hospital, which is what we take care is that core offerings are like we offer right from primary care to secondary care to the intensive care services. Look for the children and newborn who are very sick. We have a very large number of beds in intensive care services. And also we do specialties for children like gastroenterology, neurology, nephrology. We even provide services like transplant services in matured hospital, liver transplant for children, renal transplant, and as well as a bone marrow transplantations. So these are kind of hospitals which we see mostly in the developed countries. So with our background of working in UK and large number of our team members, so we brought the concept of a multi-specialty children's hospital and established in Hyderabad city. Along with it, we also developed several spokes to cover the larger part of the city to make it a kind of a comprehensive coverage for the entire city. So this is how we've been operating. We also believed in doing.
Yes, sir. Okay. And sir, also મને લાગે છે કદાચ કનેક્ટિવિટીનો પણ ઇશ્યુ છે અને આ સિવાય પણ આપણે સમજીએ. સર, also we would like to know about the usage of funds, the funds you are going to collect. What are the usages and what are your plans to expand in other cities?
So the net proceeds are going to be used a total of 280 crores. In that we have NCDs to be paid, 40 crores to CDC, which go the 40 crores of debt, and 170 crores are going to go for expansions in the hub and spoke model, and the rest of the money going for the general corporate purposes. We have a 200 crores on the balance sheet. So we have a plans to expand about 500 beds in next 3 years time across Hyderabad, Bangalore, Chennai, as well as the NCR area. These are the areas we're going to expand in the next 3 years time.
Sir, any subsidized beds would you be having? Any percentage of beds you would be keeping for the not so people who can't afford it, or any subsidized treatment would you be providing?
Subsidization we do for based on the conditions. So we do not have because we have not taken any favors from the government. It's purely a private play. But however, as a children's hospital, so we are a very kind of accommodative for children who comes into our network who requires additional assistance. We try to kind of subsidize treatment as well as kind of we raise the funding from the crowdfunding and also multiple foundations do support us in the present days. So in Delhi, we have a kind of a hospital which is a DDA, is a trust hospital where we have about 10% of the beds are dedicated to the lower socioeconomic people free of cost.